One of the things that I like the most about working at Siteman is that our psychological service is free. That means that anybody can get it. There's no insurance involvement. There's no out-of-pocket costs. You can just talk to your oncologist and they can place a referral and you can get connected. In my career, this is the only place that I've ever worked where you can talk to a psychologist for free. But that's so important because there's already so many expenses. And we don't necessarily want to add on any extra stress. And so that's one of the things that I do love the most. Prior to coming to Siteman, I actually worked at a VA and I helped people with different forms of addiction and health behaviors, quitting smoking, quitting drinking, eating healthier. I have been able to continue on with some of those things at Siteman. So I do help people with their tobacco use, also help people in regards to eating healthier, becoming more active. We know all of those are important in regards to reducing risk of cancer development or even recurrence. I have been able to take some of my previous experiences and be able to apply them here, which has also been a joy for me. In regards to what interests me the most with psycho-oncology, was actually just family experience. My dad was diagnosed with 2 different types of cancer, and seeing him go through treatment and the struggles that not only he had, but also my mom had in regards to caring for him. And one of the things that they always told me was the most helpful was a counselor that they worked with. That really got me thinking about this specialty, and that's what really led me to pursue that, to be able to not only learn more about what my dad actually went through, but also to help others, just like that counselor helped them. And so that was really meaningful to me and just made a big impact in regards to what I wanted to do. I think with my dad's experience, it's given me the experience of both family and now provider. Over the years working with so many different patients, I've learned so much about what the experience is. And I think back to when he was going through it, and there's so many things that I wish I knew then and wish that I could have done differently. And so taking that experience not only to help our patients, but also to help their caregivers, to help them be able to look at things differently, kind of in the way that I wish I looked at things differently, knowing what I do now, but I didn't know then. And so by having my father go through what he went through and being his son and a loved one, I have that perspective, but now because of my time working with patients and learning from them, I've also been able to kind of help other family members along the way as well, because it really impacts everyone's life, not just the patients. In regards to caring for the caregivers and the family, just as important. Because when cancer patients are going through their treatments, they're not only thinking about themselves, they're thinking about their children, their spouses, their partners, their parents, everybody, because they know how this is also impacting them. And I think one of the last things that anybody wants is to cause pain, to cause suffering with a loved one. In a way, it can be very reassuring for the patient to know that their loved one's also being cared for. And that's one thing about our service is that we want to make sure that we're taking care of the caregivers, because also caregivers do a lot. And sometimes that can be very overwhelming, and being able to help them, figure out how do you take time for yourself? Because one of the biggest things is the focus on the other person. But I always help people remember that it's hard to fill up other people's glasses if yours is half empty. And so that's the importance of self-care, especially for caregivers. The better you take care of yourself, the better you're going to be able to take care of your loved ones. How does that feel like to follow someone all the way through? I would say very fulfilling. I mean, to start a journey with someone at arguably one of the hardest points in their life, emotionally, mentally, no one expects to hear cancer. And for most people, it really changes their perspective, their outlook on life, and to help them walk through that journey and to be there, if nothing else, as just a partner, but also as someone who can provide suggestions to help them better cope with it, make it a little less burdensome. But to actually be able to see people go through and come out on the other end, it's really amazing. Because I think a lot of times people don't realize how amazing they are and how strong and how resilient they are. But to be able to be on the outside and watch that, I can't think of anything else that's really more fulfilling than that.